radius is a long bone, has a proximal and distal end and shaft folder. In proximal end, we can see head, neck, and radial tuberosity. In proximal end, we can see head, neck, and radial tuberosity. Superior surface of the head articulate to capitulum. Superior surface of the head articulate to capitulum and form brachioradial joint. Peripheral part of the head, peripheral part, this one. Peripheral part of the head articulate to ulnar and form radial ulnar joint. Okay? Head articulate by two bones, superiorly humerus, periphery, ulnar. Radial tuberosity is important because tendon of biceps brachii attached to it. Radial tuberosity is important because tendon of biceps brachii attached to it. Shaft or body has not important structure except of medial border, this one, except of medial border. All long bones. This one is a horizontal or transverse section of the long bone. Okay? Transverse section of the long bone. Humerus, radius, ulnar, femur, all long bone has three surfaces. For example, posterior surface, medial surface, lateral surface. Okay? This one is a transverse section, horizontal section of the long bone. All long bones has three surfaces. For example, posterior, medial, and lateral. And three borders. This border is anterior, this one medial, and this one lateral border. This figure shows me all long bones has three surfaces. All long bones has three borders. Okay? Two structure in all long bones always are like. For example, medial border, medial surface, lateral border, lateral surface. And one structure is exactly opposite. Anterior border, posterior border. Okay? In this figure, you can see lateral border, medial border, and posterior border. Lateral border, medial border, and posterior border. Surface, this surface, anterior is opposite the posterior. Lateral and medial surface. For this reason, you need to memorize all surface, all border, because this is not important. You must memorize a spatial feature, a spatial landmark in each side. Shaft or body of the radius has three surface, three border. All of them, nothing. It's not important. But this border is important. This border is medial border or interosseous border, because a membrane that is called interosseous membrane attached to it. But And for this lamb, this border is very, very sharp. It's very, very sharp because interosseous membrane attached to it. Okay? So, body or shaft has just one important structure. This structure is medial border or interosseous border. Distal end or lower end of the humerus has 5 surfaces: anterior, lateral, medial, posterior, and inferior. Okay. Medial border has this notch. What's the name of this notch? This notch. Ulnar notch. Because articulate to ulnar. For this reason it's called ulnar notch. Medial surface of the distal end has a notch. This notch is called ulnar notch because articulate to ulnar. Lateral side has this process. Lateral side has this process. This process is what? This process is called styloid process. Styloid process. Styloid process. Okay? So, medial surface has ulnar notch, lateral surface has a styloid process. Anterior surface is not important. There is no special structure. But posterior surface, this one touch. This one is a styloid process, a lateral side of the radius. Okay. Posterior surface, you can touch other special structure. Posterior surface. This one is dorsal tubercle or tubercular blister tubercle. Okay? This one is dorsal tubercle or blister tubercle. The posterior surface of the radius. The posterior surface of the radius. Review. Distal end of the radius, lateral side, you can touch. A styloid process. Posterior surface, you can touch. Dorsal tubercle or distal tubercle. Medial side has a notch. This notch is called ulnar notch. Okay? Anterior surface is not important. It's a smooth. Inferior surface. Inferior surface of the radius. Inferior surface of the radius is one. Inferior surface of the radius articulate to scaphoid and the lunate of carpal bones. Scaphoid and lunate of carpal bones and form special joint. Well, what's the name of this joint? Radiocarpal joint. Fiber joint. Condyloid. For this reason we have flexion, extension, abduction. This movement takes place this radiocarpal joint. Okay. Ulnar bone. Anterior posterior. Ulnar bone. Ulnar bone is a long bone, has a proximal end, distal end, and body or shaft. Proximal end is like French, and that's three. For example,
Key. French key.
French key. Yes. Okay. is not okay. You can see four. You can see five most important structure. Five most important structure. This one is laterally, anterior, posterior. Okay. This one is laterally. This one is lateral. Okay. This one is called olecranon process. Olecranon process. This one, this structure. This bone behind of the elbow is called olecranon process. You can touch it. Okay? Olecranon process. Below it, olecranon process insert into the olecranon fossa in full extension. Full extension of elbow, olecranon process insert into the olecranon fossa. Olecranon fossa of the humerus. Below it, you can see this notch. This notch is called trochlear notch, because articulate to trochlea of the humerus. This articulation is called, name of this articulation. Type, no, name. Humero-ulnar joint. Humero-ulnar joint. Type is hinge. Okay? Below it, you can see this process. This process is called coronary process. Coronary process. The coronary process fill the coronary fossa in full flexion. In full flexion, coronary process fill the coronary fossa in full flexion. Below it, you can see this process. Below it, you can see this process, this one. This process, this one. This one is called ulnar process. Ulnar process. For attachment of brachialis muscle. Ulnar process for attachment of brachial muscle. And finally, in the lateral side, here, you can see this notch. This notch. What's the name of this notch? This one. Radial notch. Because articulate to radius. Radial notch belong to ulnar. Ulnar notch belong to radius. I ask you, what is this? I ask you, what is this?
What's what?
Your course is experimental. Your course is not geography course, history course, math course, okay? All of them are theory. Medical course is experimental. In experimental, you need use eye, vision, and touch. For more memorize, you need a spell. All now you can see. Okay? So you must active. This part is active. This part is middle. Okay?
Medial.
I ask you, what is this? This one.
We can't see the indicators. We
All
can't
the
see the
There's
indicators.
point.
You can see what pointer. This one. Olecranon process, this one. Colony process, between them. Coronary notch. Below coronary process, you can see ulnar tuberosity for attachment of brachialis muscle. Brachialis muscle. This notch, regular notch, contribute to formation of which joint? Radioulnar joint. Okay. Which part of proximal end? Which part of proximal end of the ulna can palpable or touchable? Just olecranon process. Okay. Body or shaft has three surfaces. Body or shaft has three surfaces. But two structures is important. One, this border. This border is lateral border or interosseous border because interosseous membrane attached to it. For this reason, this border is very sharp. Is very sharp. One. Second, this border. This border. What is this border? This border. Posterior border. Posterior border. Okay? What is this? Touch. What is this? Olecranon process. You can touch posterior border in all lengths of the ulna to reach this process. This process called spinal process. Okay? This border is very important because it's a landmark for diagnosis of fracture of the ulna. Fracture of the ulna is diagnosed by posterior border. Okay. Distal end of the ulna is called head of the ulna. Head of ulna is in lower end. Head of the ulna has five surfaces. Lateral surfaces articulate to radius, forms inferior radial ulnar joint. Medial surface contain crosses. This process is called styling process. Anterior surface and posterior surface are not important. Lateral, medial surface are important. Anterior and posterior are not important. This one, inferior surface. This one, inferior surface. Inferior surface is one. Don't articulate to carpal bones. Don't contribute to formation of wrist joint. Okay? This area is empty and occupied by a fibrocartilage structure that is called disc between ulna and carpal bones. Okay? Lower end of the ulna doesn't contribute to formation of the wrist joint and fixed by fibrocartilage disc. Okay? Which part of the radius is palpable, is touchable? Which one? Radius.
Posterior part?
All part of radius covered by muscles. Okay? Except of this process, spinal process, this tubercle, dorsal tubercle. Okay? anterior surface of the lower end. Anterior surface of the lower end is important because we can sense pulsation of the radial arch. Okay? But behind of the elbow, lateral side, this one is olecranon, okay? In this side, para-olecranon fossa, lateral and medial. This one olecranon process, lateral para-olecranon, para-olecranon. Lateral para-olecranon, you can touch. Supination formation, you can touch. Head of the radius, okay? Head of the radius, you can touch. So, tree structure is palpable. Head of the radius, scaling process, dorsal, okay? Carpal bones. Carpal bones. There are 8 carpal bones that is arranged to proximal and distal row. That is arranged in proximal and distal row. In proximal row, from lateral, in proximal, distal. Okay? Proximal row from lateral to medial. We can see this bone, the scapula, this bone, lunate, this bone, periquetron or periquetron, and this bone, pisiform, okay? And this together you can see the scapula, lumen, periquetron, and the uterus there is pisiform. Anterior surface of the wrist, you can see some crease. Distal crease. In medial side, you can touch this bone. Medial side, okay? You can touch this bone. What is this? Pisiform. Okay? Show me pisiform. Distal crease, okay? This one is pisiform. Okay?
It's here.
Pisiform. Lateral side. My instrument is back side. Lateral side. Okay? I can touch scapula. Lateral side is scapula, medial side pisiform. Okay. Distal row from lateral to medial, you can see trapezium, trapezoid, capitate, and okay? Trapezium, trapezoid, capitate, and hand. Trapezium, trapezoid, capitate, and hand. Okay? For memorize. trapezium and trapezoid may be mistake, make mistake. Okay? For this then we learn this one is tongue. Tongue has U. Which one has U? Tongue. Trapezium. Okay? Trapezium articulate to tongue. For this the lateral bone of distal row is trapezium. In this figure, you can see carpal bones, all of them are small bones. All carpal bones before birth are cartilaginous. After birth, all cartilaginous. Okay? Which bone which cartilage start to ossification? Largest bone. Which one? Capital. Capital is largest bone. The first one start to ossification. The first cartilage start to ossification. Which bone is last cartilage to ossification?
The smallest TV.
Small. Which of them? Which of them? Physical. Physical is smallest one and is last cartilage to ossify. Last cartilage to ossify. Okay? Ossification of the carpal bones is used for detection of age in a sport. Okay? Children and other group of sport man is classified to different groups. Okay? 8 to 12, 12 to 15, 15 to 18. Okay? By these bones, in radiology, these bones, this cartilage begins to ossification. This ossification started by capital, okay? Opposite the clockwise. Capital. Hamid. Terrible thought. Lune. Scapula. Trapezium. Trapezoid. Okay? This is arrangement of ossification in carpal bone. Start capitate and the last cartilage is okay. Hamid has a hook. Hamid has a hook. I try to show it. Hamid start by H has a hook. In medial side, two structures is important. Hamid and physical. In lateral side, scaphoid has a tubercle. Trapezium has a tubercle. In lateral side, trapezium and scaphoid are important because a special structure is one. A special structure is one. Attached to to these bones. This structure is called flexor. Flexor retinaculum. Flexor retinaculum is a part of the deep fascia. Flexor retinaculum is a part of the deep fascia attached to some bones of the carpal bones for keep the flexor tendons in location. Okay? When I want to flex wrist, okay? Flexor tendon sheath anteriorly. Okay? For herniation of it, there is a special structure here. Maintain this tendon in this location. This structure is called flexor retinaculum, attached laterally to trapezium and scaphoid, medially to pisiform and ammonite. Pisiform and ammonite. Okay. This joint is called, name of this joint is called intercarpal joint. Type of them, plane. Type of them, plane. Okay. Metacarpal bones. Metacarpal bones. Metacarpal bones. Metacarpal bones is a long bone, has a shaft or body and proximal end and distal end. Proximal end is called base, distal end is called head. Okay? Anterior surface of all of them are concave. Anterior surface of all metacarpal bone are concave. Why? Formation of 20 muscles. 20 muscles are here. 20 muscles are here. For this reason, anterior surface of them are concave. But posterior surface are convex. For this reason, I can touch posterior surface of them. Okay? Touch metacarpal bones. Okay? And then it is not possible. It's not possible. And this surface is impossible because located 20 muscles. But posterior surface is on the skin. For this reason, posterior surface is touchable. Okay? This joint is called carpometacarpal joint. Carpometacarpal joint. All of them are tight.
Hinge.
No.
Condyle.
No.
Cell.
No. Plain.
Plane.
All of them are plain, except of first carpometacarpal is saddle. Is saddle. Okay? Gross plate for all metacarpal bone is near to head. But for first metacarpal bone is near to base. Okay? Gross plate of the second metacarpal bone is near to head. First is near to the base. Okay? Phalangeal bones. This one is
Medical.
metacarpal bone. This one, phalangeal bones. Okay? Proximal, middle, distal. All fingers has three phalanx, except of the thumb has proximal and distal. This joint is called interphalangeal. This one, interphalangeal joint. How you identify this? Proximal, distal. Proximal interphalangeal, distal interphalangeal. Type of this joint, hinge. This joint is name. Metacarpophalangeal joint. Head of metacarpal. This one phalanx. This joint is metacarpophalangeal joint. Type of them, condyle. How many movements?
4.
Flexion, extension, abduction, adduction. In this figure, you can see this bone, scaphoid, lumen, periquetral, physical. Okay? But the scaphoid is fractured. Common site of fracture of carpal bones is the scaphoid. Fracture of the scaphoid is common. Common site for dislocation of carpal bones. Dislocation of carpal bones is scaphoid fracture, lunate, dislocation. Okay? In this figure, you can see fracture of the scaphoid. Fracture of the scaphoid. How you can diagnose fracture of the scaphoid? You are ready. Okay? Okay? When your thumb is hyperextend, okay? You can see this depression. This depression is called a snuff box. Ancient people used for okay? Or what? Addict. Okay. This one is called a snuff box. Deep to this snuff box, you can touch a scaphoid bone. When you pressure on the scaphoid bone, there is some pain, okay? But when a scaphoid is fractured, very, very painful. A scaphoid fracture is very, very painful when you pressure on it. Which part? A scaphoid. A scaphoid part into the snuff box.
No, make him this paint. Can you make him this paint?
This pain is fracture, separate. Okay? You pressure on it. It's very painful. This depression is called a snuff box. Anatomical. A snuff box. Okay? side of fraction of the for R, common side of fracture for R. When I fall in outstretched hand, this one is outstretched hand, okay? I fall on palmar, this surface is palmar, surface of the hand. Okay? Distal end of the radius fracture and move backward. Distal end is moved backward, this one, move backward. This fracture is called Carl's fracture. Carl's fracture. Okay? Fracture of the distal end of the radius and move backward is called Carl's fracture. But when I fall, this position, this one. Okay? Distal end move forward. This fracture is called Smith fracture. A Smith fracture. Okay. Really, I ask you, you must answer to. How many bones contribute to formation of bony skeleton of the upper limb? How many? 32. 1. The most important feature of the clavicle is palpable on all lengths. Is touchable in all lengths, from medial to lateral. Okay? Because it's on the skin, subcutaneous. Okay? Medial end is called sternal end because articulate 2 forms type
fibrous.
Excuse me. Touch. Your hand forward, backward, shoulder forward, backward. This movement takes place in this joint. For this joint is not plane, but is saddle. Elevation, depression, forward, backward, take place in sternal joint. This joint. Name. Type. Plane. For this event, in all movement, you cannot sense movement in this joint because movement is slide, spinning. Which muscle attached to clavicle? Deltoid, pectoralis major. Anatomy is very easy if you understand how to study it. Okay. Open book. Pectoralis major. Deltoid attached to clavicle. This muscle and this muscle attached to clavicle. Okay. This one, scapula. Which part of the scapula is touchable? Spine. Acromion process. Inferior. Angle. Which border? Medial border is palpable. Okay? Medial border, inferior angle, spinal acromion process. I touch this muscle, for example. What is this muscle? Super. This muscle. Most of them are innervated by Head of humerus, articulated scapula. Which part of the scapula? Pelvic cavity. For this joint is called humeral joint. Type. Ball and socket. Ball and socket has flexion, extension, sagittal, abduction and abduction, coronal plan, lateral and medial division, horizontal plan. Has three plan for movement. Okay? Humerus. What is this? Greater tubercle. What is this? Between them. Intertubercular groove. Which structure has long hilar bicep? Which muscle attached to fluid? Lattice dorsi, medial border. Teres major. Lateral border. Teres major. Okay? This tuberosity in lateral side of the body of the deltoid tuberosity, because this muscle attached to it. Lower end, we can touch this one. Medial epicondyle. This one. Lateral epicondyle. Between them, anteriorly, from medial to lateral. Trochlear and capitular. Above trochlear. Coronary fossa. Capitulum. Radial fossa. Posteriorly. Olecranon fossa. Which nerves relate to humerus? Axillary nerve, radial nerve, and ulnar nerve. Okay? Ulnar nerve. Touch ulnar nerve. Touch ulnar nerve. No, mashallah.
Vision the jaw.
Is muscular. Okay. Okay. It's not ulnar. Ulnar nerve. Okay. Posterior surface of the body of the humerus contain a groove. Direction of the groove from superomedial to infralateral. From superomedial to infralateral. This one is important because next session you can see lateral to groove is attachment of lateral head, medial to groove is attachment of medial head of the triceps. What is this? Olecranon process, in which movement this process feel the olecranon fossa. Full extension. In which movement coronary process feel the coronary fossa. Full flexion. Okay? Which part of the radius is palpable? Is touchable? Head of the radius. Stable process, dorsal tubercle. Stable process, dorsal tubercle. Which part of the ulna is palpable? Olecranon process, posterior border, and scalar process. Okay? Okay. Carpal bones. I can move this bone. What is this bone? Physiform is cultural. In lateral side, disform, scaffold. Proximal row of the carpal bone from lateral to medial are scaphoid, lunate, pisiform. Distal row from lateral to medial. Retinal fluid, retinal fluid attached to which carpal bones? Scaphoid and trapezium laterally, pisiform, hamate, medial. Okay? Pisiform, hamate, medial. Which bone is first ossified? Last ossified. Carpal bones. The joint between carpal and metacarpal bones is called carpal metacarpal. All of them are plane except of first. Second. Finish with. Inshallah, next week. Okay?